So Krista and I worked on, oh, I think that I just got the notice of recording, so I'll say that again. Thank you again for inviting us to this interesting and innovative discussion club. We are going to be presenting on our project that stemmed out of a larger work, out of some larger work where we noticed some challenges in publications with patient partners. Many teams have recognized the value of patients as part of research teams, but in terms of publication, there are some hurdles that we've experienced that our patient partners have experienced, and we thought we might be able to share some of that knowledge and lessons learned and some opportunities to improve the process with the larger community. We know that for many years, we have been acknowledging the valuable contribution that patients can play in multiple aspects of research. Everything from designing proposals where we can generate ideas together and co-create work together, reviewing drafts of publications or research grants, ethics applications, making sure we're paying attention to the values and preferences of the people we are hoping to serve from our research, being on advisory groups, helping collect data from communities where patients may have more connections than research teams, analyzing data and discussing how we're interpreting those data that we collect, disseminating and implementing our findings, and dialoguing with larger groups to set priorities for research funding. So co-authorship of articles comes into the dissemination phase, but it's really just one phase. And I feel that we should be doing this more often since we're engaging patients in all of these other aspects of our work. And as we work together, we are true partners in this process. And it's not that patients are participating early on and then not at the stage where we're actually describing what we found and how we're interpreting what we found. But we found several barriers that we outline in our paper to engaging patients in the specific publication part of dissemination. One, there's some unclear criteria for authorship and journal policies, which we'll describe in more detail. There are also some burdensome authorship forms during the submission process. These forms and details from journals often require people to share bios and affiliations, which are not always as transparent for patients. There's confusing and complex conflict of interest disclosure statements, and there are some guidelines that talk about compensation that may or may not apply to patient partners. So first, we wanted to highlight many journals that use the international criteria for publication in journals, the ICMJE, and they talk about recommendations for authorship based on these 4 key criteria, which many of you are familiar with. One of the challenges is that as we are going through this process at the final stage of contribution, we may be encountering some of these gaps in some of the criteria. And here are some examples. So we'll start with the forms. A patient responded to an automated journal email that was sent to all participants of the process, and the email bounced back because it wasn't an actual address. So in other words, as they were asked to click on something to confirm that they were a co-author, they instead replied and said, yes, I am part of this process, and it bounced back, which led to lots of confusion. When we tried to work together to click on the link and go to confirm participation, it required a very lengthy login because you need to be a member of the journal submission portal in order to confirm your authorship. And then they ask for an ID specific to many people in academics that link to this unique identifier for you as an author, which many patient partners may not have. Once we got past that hurdle, there was also some uncertainty in how to answer questions about whether the person was paid for contributing to the work, whether it was the author's own work or it was work that was done as part of a job, and whether it was government funded. So in academics, we individually, if we work for a university, we're not getting paid on top of that to write papers. That's part of our job. But we value the contribution that advisors and partners on our projects contribute. So we do pay people for their time. And that also leads to confusion about whether that's for hire or whether it's people's own ideas. We also do get funding from government agencies. So many of us that have been publishing for many years understand these questions are specific to, are you doing this because someone is trying to bias or influence you, or are you doing this because it's your own original ideas? But that is much more of a gray area and more uncertain for people that are doing this as part of this research team, as a consultant or an advisor on projects. The next step, which is important to this international criteria, is to determine who you are and who you're representing. And that doesn't necessarily become as straightforward when you are representing yourself as a patient and not your employer or not your hospital that provided you care. And some people don't want to publicize their role as a patient partner because they may be, let's say, on disability for their illness, but doing this as part of giving back to the community. But that can appear as if they're working while they may be qualifying for benefits because they're unable to do their main role in their job. Other people that are working may not want to list their employer. There may be some conflict there, or there may be concern about, well, I'm not really doing this work on behalf of my job. It's a different aspect of my life that I'm representing. And so that became a challenge for our patient partners as well. What do I list on my affiliation and bio? These journal forms are requiring me to say not just who I am, but how I'm affiliated with a company or an organization or an individual. And then conflict of interest disclosures are also required by international criteria for authorship to make sure that we're not influencing the work that we're doing based on some financial gain we could get from a for-profit entity. Now, if I'm doing some consulting for a for-profit entity, I, of course, disclose that because it's outside of my day-to-day job as an academic researcher. But a patient may work for a company that isn't really involved in the work that they're doing. They're doing this work as part of their individual role as a patient advocate or as a patient who has experienced an illness. And so, where does that line get drawn for people who have a for-profit company as their primary place of employment, but they're representing themselves as an individual and not really doing work on behalf of that company? There's also listings in good publication practice guidelines that talk about authors should not receive payment in exchange for listing their name on a byline, which is true. We should not be paying people to be part of this process. But the statement doesn't automatically disqualify people who are medical writers or people who get a salary for professional activities that might confer authorship through those professional activities. So this is another gray area about making sure we're valuing the contributions patients are playing and acknowledging that financially and in terms of their credit that they have become partners in this process, but not going beyond what's considered good publication practice, which is more relevant and was created with companies in mind and not necessarily patient partners. So we put together some recommendations. Krista really led this part of how do we handle this? How can we do this better in the future so we don't run into these roadblocks? In all of our processes, whether it's academic or patient partners, we always want to talk about the authorship process at the beginning of a project. How would people like to be involved? How would they like to be part of the writing process? How would they like to be acknowledged? And we have identified areas where we could clarify the language in the instructions, where there's areas that are clear but just not clearly worded. We can provide better instructions to patient co-authors. And then we've also identified where the language isn't necessarily clear, regardless of how much we simplify the complexity. There are trainings that could provide additional resources for people who are new to the publication process to help understand these hurdles that exist currently. And then to plan for the future, we also have some ideas for how to get feedback from patient partners on their experience. So while we're working within the system we have, we can identify ways to make this better in the future. So here's some adapted criteria that we thought could apply to patient partners. To be a co-author of a manuscript, people could provide a valuable contribution using their expertise as a patient to help design the study or help identify and describe the findings. So even if they haven't done extensive writing, they could still be a valuable contributor. They also should provide useful comments during the writing process, whether that's in writing or team meetings. They should read and approve the final version, and they should take responsibility for contributing to the manuscript if they need to answer questions about their role on the process. We also identified a training from the work group of European Cancer Patient Advocacy Networks that helps people learn about the process of publication. And we also found a website on envisioning patient resources, which helps people learn about how to be involved in this process, especially when there's industry sponsors and academic collaborators, and patients have been part of that process. So the different levels of engagement from different sponsoring organizations. So Krista put together these nice discussion questions, and I'm going to turn this over to her to lead some of the discussion based on what you heard from us and some of your thoughts. But before we get into the discussion, I just wanted to acknowledge that this was a real team effort. We have several patient partners who gave us feedback on the process through some collaborative work on a multi-site study on anesthesia choices for different types of anesthesia options. And we also have a patient partner who was on our original publication that helped us launch this work and think through some of these challenges. So we're really grateful to their teamwork as well. So I'm going to leave this slide up, and I think that maybe you can let us know how we do the discussion portion. I think you maybe stop the